Hi, welcome to this presentation on prioritizing pest management. Now, I struggled a little bit with trying to put together the information to explain what prioritizing pest management means, but I think we've got this down to something that's going to be helpful to you. Now, when we look at pest management, we know that historically it's looked a lot like this: spray down, use a lot of pesticides, high dependence on chemistry. I know when I started in the pest control industry almost 40 years ago, that was the way things were done. It led to a dependence on chemicals, and more importantly, it led to a situation of tolerance and resistance in a lot of insect populations. This is not the way that it's supposed to be, but it's unfortunately the way a lot of people still think about pest management around the world and in all industries, including the healthcare industry. Where we're supposed to be is focusing on integrated pest management, IPM. This is more of a target specific approach. What works for a cockroach will only affect a cockroach today. It focuses on the environmental aspects, the concerns about the total environments, the macro environment of outdoors, but that micro environment where we work at, inside our houses, inside our buildings that we work in. So that's what IPM is focused on. But more importantly, it's focused on the prevention of problems, not the fixing of problems, but the prevention. And that's where it gets very critical to prioritize, particularly in your industry. If it's looked at correctly, IPM contributes some major aspects to the healthcare industry. Lower cost. We've proven scientifically, the pest control and the research communities have proven scientifically that the cost of an IPM program is less over time because of the way it works. It focuses on not having pests, on preventing those problems from ever coming up in the first place. So it's a lower cost advantage. There's fewer pest issues that create public relations issues for us. And it also becomes a better part of your infection control program because IPM is an infection control tool and should be a part of your infection control program. Now, how do we look at this? Well, to prioritize, we have to understand that we are constantly focusing on improvement, not compliance, but compliance with improvement. So I looked at the Environment of Care Standard 3.10 and pulled out 4 elements of performance that are listed in that standard that are related to pest management. So let's buzz through these quickly. Performance number 1, a plan has to be in place for hazardous materials and hazardous waste. And part of that is the pest control program. And to show an improvement on that, you have to have written IPM plans in place and focusing towards that goal of moving to an all-out IPM approach. Performance number 2 is the inventory of hazardous materials. That's both physical inventory as well as applied inventory. So the improvement levels here that we look at are the quantities of pesticides used, tracked and documented over a successive time period. Does that time period show a reduction in inventory and a reduction in applied product? If that has reduced, then our evidence of improvement has occurred. We have improved on our program and improved our environment by reducing those amounts. Element performance number 3, getting the implementation of a program, restricted use pesticides no longer used, IPM facilities, or excuse me, programs in place that include monitoring, non-chemical methods, pesticides as a last resort, and then only the least toxic items first. And then the other one is performance number 7, and that's the documentation. Do you have a written IPM plan that is reviewed annually, updated as necessary, so you're always working towards being better, moving from good to great? And that's what we want to do. So with that, we have some time for a few questions.
Thanks so much for watching our expert on IPM. I'm Sean Lynch, the Director of the IPM and Healthcare Facilities Project at the Maryland Pesticide Education Network. We hope this has inspired you to consider new steps you can take to make your facility safer for your patients and staff. Please reach out to me at email at sean@mdpestnet.org if you have any questions regarding implementing IPM at your facility. To learn more, please visit the project at mdpestnet.org. Choose projects and then the IPM and Healthcare Facilities Project.